Hi, Dr. Paul Coleman here, Coleman Center for Cosmetic Dentistry, with this week's episode of Dental Health with Dr. C. I'd like to try to clear up a couple of things. There's a lot of confusion out there because every dentist in town that has a placard in front of his building says, family dentistry, cosmetic dentistry. What's the difference? General dentistry is what you can do when you get out of school, basically. They teach you enough in dental school so you can pass the boards and try to make a living. That's kind of it. You do a little of this and a little of that, and maybe not any of it's spectacular, but you can do a wide range of things. Then you find, as you go through your profession, you can elect to pursue excellence in certain areas. Everybody considers themselves a cosmetic dentist, but obviously, I don't know how to break this to you, we're not all created equal. So, if you want someone who's actually done a lot of elective cosmetic dentistry to enhance your smile, to give you a better self-confidence, you really need somebody that sort of knows what he's doing. That would be kind of good. So how do you find this type of person? Well, there's a lot of ways. Number one, go to their website, because cosmetic dentists that are really good at this have an ego as big as this. And yes, that's me too. Because you're doing stuff to enhance people's lives, and that's a different level of care than sticking a filling in or rubbing some tartar off your roots. So exactly how would one as a dentist even go about getting this level of expertise? Well, I personally sought out the best cosmetic post-grad program there is in the world, and that's at the Las Vegas Institute for Advanced Dental Studies. This is just an unbelievable facility that dedicated itself to enhance the skills of people that really wanted to do cosmetic dentistry at a whole different level. Had to fly patients in, spend weeks at a time, and the curriculum was pretty strict. I actually finished it up about 12 years ago, and it just changed the way and the care that I can provide for people. So, if you're looking for a cosmetic dentist, and it's sort of like, okay, how do I find somebody? Go to websites. Everybody's got a website, and there should be a lot of before and after pictures. And if there's enough before and after pictures, you should be able to actually look through the portfolio and sort of find exactly what your problem is in the before, and you can see the after right next door. Now these aren't some vague image-driven graphic Photoshop things. These are actual patients. And it's really important that if you go into someone for elective care, which is generally not covered by insurance, that you want to make sure that your hard-earned dollars are actually going for a level of expertise that you deserve. Next thing you want to look at is when you come to the office, look at the staff. I mean, if the staff's smiles are bright and vibrant, and the dentist's families, has great smiles, actually look at the dentist. It blows my mind how many people say they're a cosmetic dentist, and their teeth are kind of gnarly. It's sort of like, well, how committed is this person to this type of care if he won't even do it on himself? There's a giveaway. Go to the office and look around. If the waiting room sort of looks like a hospital room in an inner city, and that's probably not the environment that can give you the personalized care and attention that you really deserve and you really want. So the before and afters are just absolutely huge, but do some consultations, seek out some advice, and whether it be with me or multiple people. I had one guy came in and I was his 11th consult out of 13. And he ended up having me do the work. And I said, why'd you pick me? He goes, well, some of these doctors thought they walked on water. I said, well, I can, but it's got to be really shallow. Anyways, case turned out great. In fact, he's on my website right now, if you can figure out which one it is. Anyways, I'd invite you in for a consultation if you have some concerns, if your teeth are discolored, if they're rotated, if they're crowded, if there's some spaces and you just don't feel comfortable. Somebody picks up that camera and you smile like this, you might want to think, maybe it'd enhance my social skills and make me feel a little bit better at work and come across with a little bit more confidence if I could actually, show my teeth. So, if there's something about your smile that you don't care for and you think that maybe could be enhanced, there are so many different options available to make these type of improvements. You really need to sit down with someone that does this type of work and see what's available and if it's right for you. So that's this week's Dental Health with Dr. C. Hope to see you soon.